When you're going to be administering medications through an IV bolus or push through an intravenous infusion, you're going to want to first gather all your supplies. You're going to make sure that you check the medications 3 times. And then after you go into the patient's room, you're going to have to check for 2 different identifiers, which could include the patient's name, date of birth, their identification number, and then you're also going to check their allergies before administering the medication. After you've made sure that you have the right patient and you have the right medications going to that patient, and as well checked for their allergies, you're going to assess the IV site for any infiltration or phlebitis or anything that might interfere with the patient receiving the medication in this IV. Next, you're going to pause the infusion pump. Then you're going to put on clean gloves. You're going to select the injection port that's closest to the patient. Then you're going to close the clamp on the administration tubing. After that, you remove the disinfection cap from the injection port or the end cap. If there is no passive disinfection cap in place, you're going to you're going to use an antimicrobial swab on the injection port to clean it off and sterilize it. Next, you're going to uncap your saline flush, and then you're going to hook it up to the injection port, and you're going to first aspirate to see if there's any blood return. If there is blood return, you can go ahead and inject your saline flush into the injection port over a minute or per the facility's policy. Next, you're going to use another antimicrobial swab to wipe down the needleless connector end cap on the injection port. Then you're going to uncap your medication syringe. You're going to hook up the medication syringe to the needleless connector or end cap on the injection port. And you're going to instill the medication based off of the rate that was prescribed. You're going to make sure that you have a watch available with a second hand so that you can accurately time the rate. While the medication is being delivered to the patient, you're going to make sure that you observe the insertion site, and you're going to observe the patient for any adverse reactions. If any adverse reactions are noted, such as infiltration or phlebitis, or if you notice that the patient is getting tachycardic or their blood pressure has increased by a lot, you're going to immediately stop that infusion or bolus, and you're going to call the provider. If nothing has been noted, any adverse reactions, you are going to then detach your medication syringe, and you're going to use another antimicrobial swab to wipe down the needleless connector end port, and then you are going to use another saline flush syringe, and you're going to attach that to the injection port, and you're going to push the saline solution over the same rate that you instilled your medication at. Then you'll remove the saline flush and use another antimicrobial swab to wipe down the needleless connector or end cap on the injection port. You also are going to need to unclamp the administration set, and then you're going to be placing a passive disinfection cap or end cap on the injection port. Then after that, you're going to restart your infusion pump and check the IV infusion rate. You're going to then discard any of your syringes into your sharps box, and you're going to observe the patient for any signs and symptoms of any adverse reactions. Then you're also going to make sure that you document the medication that was given, the time that it was given, immediately after it's been administered. You also will want to remove your PPE and perform hand hygiene. So for administering medication through an IV push or bolus through a medication or drug infusion lock, You're gonna first make sure that you perform all your pre-step checks, such as making sure that you have the right medication, performing those 3 medication checks. You're gonna do your patient identification, and you're gonna perform your hand hygiene. Then you're going to assess the patient's IV site for any signs of inflammation or infiltration. You're gonna put on clean gloves. Then you're going to remove the passive disinfection cap from the access port on the medication lock. If there's no passive disinfection cap present, you're going to wipe down the access port with an antimicrobial swab. Next, you're going to uncap the saline flush syringe. You're going to stabilize the port with your non-dominant hand and insert the saline flush syringe onto the needleless connector of the access port. Then you're going to make sure that you unclamp the tubing on the extension set of the medication lock, and you're going to pull back on the syringe and you're looking for blood return when you aspirate. If there's positive blood return, you're going to instill the saline flush over 1 minute or per the facility's policy. While instilling the saline flush, you're going to observe for any sort of adverse reactions. Then you're going to remove your saline flush syringe, and then you're going to use an antimicrobial swab to wipe down the needleless connector on the access port. After you've allowed that to dry, you're going to uncap the medication syringe, and you're going to place it on the needleless connector on the access port, and you're going to instill the medication per the prescribed rate, and you're going to make sure that you have a watch available to time the rate that has been prescribed. Also, if there's any resistance felt, do not keep pushing the medication. While you're instilling the medication, you're going to look for any adverse reactions in the patient systemically or on the IV insertion site. Then after the medication has been instilled, you're going to then remove the medication syringe and use an antimicrobial swab to clean off the needleless connector on the access port. Then you're going to flush the access port again with a saline flush, but this time you're going to instill the saline flush at the same rate that you instilled your medication. If the medication lock has a positive pressure device or valve, you're going to remove the syringe and then clamp the tubing. However, if that device isn't present and to gain positive pressure, you're going to clamp the tubing and then continue to push or flush the last little bit of saline into the medication lock. Then after that, you're going to remove the syringe, and then you'll wipe down the needleless connector on the access port with your antimicrobial swab. And then after that's dried, you're going to put a passive disinfection cap on the needleless connector on the access port. After all that's been completed, you're going to do your documentation, you're going to discard your PPE, and you're going to discard of your syringes. The first step to initiating a peripheral access IV infusion is to set up the IV solution that is going to be instilled. So you're going to want to check to make sure that you have the correct solution against the MAR. You're going to make sure that you have the right patient. You're going to perform your hand hygiene. Next, you're going to be preparing the IV solution and tubing administration set. You're going to remove the IV bag from the outer package if indicated. You're going to scan barcodes and check patient identification with the MAR. And then you're going to write an infusion stamp that has the date and time of the infusion and place that on the IV container. When you're removing sterile items from packaging, make sure that you maintain aseptic technique. The administration tubing is removed this way, and you're going to need to label that with the date and time of the next change of the tubing. Next, you're going to clamp the administration set tubing, and then after that, you're going to invert the IV container, and you're going to remove the cap off the entry site to the IV container. And then you're going to remove the cap off of the spike on the administration set. And after you've done that, you're going to use a twisting and pushing motion in order to insert the spike into the entry site on the administration in the IV container. Next, you're going to hang the IV container on the IV pole, and you're going to squeeze the drip chamber until it's approximately halfway full. Next, you're going to unclamp the IV tubing, and you're going to allow for the fluid to flow throughout the IV tubing. You're going to do this to make sure that there are no air bubbles and the entire IV tubing has been completely primed with the solution. And then you're going to close the clamp. So after you've set up the IV tubing and solution and the line has been properly primed, you're going to want to actually initiate the peripheral access IV. So first you're going to lower the patient in bed to a low Fowler's position. You're going to place a pad underneath the patient's arm that's going to have the IV in it. Next, you're going to open this short extension tubing. If the tubing does not already have a needleless connector or end cap on it, you're going to need to apply that. And then after you've done that, you're going to wipe the needleless connector or end cap with an alcohol wipe. You're going to then place a syringe that's filled with normal saline on the end cap or needleless connector, and then you're going to flush the tubing with you're going to fill the tubing with the normal saline. And then you're going to place the extension tubing back on its package, but make sure that it's within reach. Then you're going to look for a vein that should be accessible for the initiation of the IV. Most likely you're going to look for a vein within the forearm. So you're going to then put on clean gloves, and you're going to apply a tourniquet about 3 to 4 inches above the IV insertion site. When tying the tourniquet, you're going to want to have the ends of the tourniquet facing away from the IV insertion site. And you're also going to want to check to make sure that your radial pulse is still present after you've applied your tourniquet. You're going to have the patient keep his or her hand lower than the heart. Then you're also going to have the patient open his or her hand to allow for better visualization of the vein, and you're going to observe and palpate for that vein. After you've found and palpated the vein, you're going to cleanse the insertion site with chlorhexidine or alcohol, and you're going to use a gentle back and forth motion to cleanse the site. And you're also, after you're finished cleansing the site, going to allow for that to completely dry for at least 30 seconds before you even begin to insert your IV catheter. So when you're going to insert the IV catheter, you're going to want to first pull the skin taut with your non-dominant hand approximately 1 to 2 inches below the IV insertion site, making sure that you're not touching where the insertion site is going to be. Then you're going to hold the IV catheter in your dominant hand with the bevel side up at the hub, and you're going to insert it along the vein at a 10 to 15 degree angle. And you're going to keep inserting that. You're going to feel a give when you finally have gotten into the vein. You're going to continue to hold the skin taut, and you're going to look for blood return through the catheter. After you've seen the blood return, you're going to remove or separate the needle stylet from the catheter, and you're going to advance the catheter farther into the vein until the hub is at the venipuncture site. Then you're going to release the tourniquet, and you're going to activate the safety mechanism on the needle stylet. You're going to make sure that you compress the area above the catheter so that you can stop the flow of blood. After that, you're going to attach the extension tubing to the catheter hub and tighten the Luer lock. Next, you're going to stabilize the catheter with your non-dominant hand. And with your dominant hand, you're going to pull back on the syringe, and you're going to be looking for blood return. When there's blood return, then you're going to take your normal saline and gently flush it through the extension tubing. While flushing the line with the normal saline, you're going to be looking for any infiltration or inflammation. After you've finished flushing the line, you're going to then remove your syringe from the end cap. Next, you're going to apply a skin protectant to and around the site. Then you're going to apply a sterile, transparent dressing over top the IV insertion site. You're going to loop the tubing close to the entry site and anchor with tape, and then you're going to label the IV dressing with the date, time, site, and size and type of catheter that was placed. Next, you're going to use an antimicrobial swab and you're going to scrub the needleless connector end cap on the extension tubing. Then you're going to remove that cap and you're going to insert the end of the administration tubing to the extension tubing. The tubing then will be looped and held in place by a piece of tape close to the insertion site. Next, you're going to open the clamp and then you're going to set the infusion rate on the infusion pump. Or you can start the flow by releasing the clamp and counting the number of drips. You're going to assess the flow of the solution. You're going to also assess the function of the infusion device, and you're going to observe for any signs and symptoms of infiltration. Next, you're going to apply an IV securement device, if not already in place. Then you're going to apply a passive disinfectant cap to each access site. Then you're going to wipe down the IV administration set with an alcohol swab and let it dry. After that, you apply a passive disinfectant cap to each site. In 30 minutes, you're going to come back and you're going to assess the IV insertion site for any complications such as infiltration, and you're also going to check the flow rate of the solution. To change an IV solution container and an administration set, first you're going to verify the solution and perform your pre-safety checks on such as the patient identification and medication checks and rights, as well as performing hand hygiene. First, you're going to remove the administration set out of the packaging using aseptic technique. You're then also going to apply a label to the tubing that has the day and date of the next set change. If you're using an electric device for infusion, you're going to pause it and then you're going to close the clamp on the administration set closest to the drip chamber. If the solution is infusing by gravity, you're going to close the roller clamp on the administration set. Next, you're going to remove the cap on the entry site of the new IV solution container. You're going to make sure that you do not contaminate the exposed entry site. Next, you're going to take the completed IV container off the IV pole, and you're going to invert it and you're going to remove the administration spike from the entry site. And also at this point, make sure not to contaminate this administration set spike. Then you're going to use a twisting and pushing motion to insert the administration set spike into the new IV container solution's entry site. Then you're going to hang the new solution on the IV pole. If you're using an electronic infusion device, open the slide clamp, then check the drip chamber, then verify the flow rate, and then you hit infuse or run. If infusing the infusion by gravity, slowly open the roller clamp and count the number of drops. Adjust the drop rate. Adjust until the proper drop rate is achieved. To change an IV solution container and administration set, first you're going to properly prepare the container and administration set. Next, hang the new IV container on the IV pole. Then you're going to clamp the existing administration set and the short extension tubing. If you're using an electronic infusion device, you're going to remove the existing or old administration set, from the infusion device and then insert the new administration set into the device. Next, you're going to put on gloves and remove the infusion tubing from the needleless connector or end tube on the short extension tubing. You're then going to use an alcohol wipe to wipe down the needleless connector or the end cap and allow for it to dry. Then you're going to remove the cap from the new administration set and you're going to insert it onto the needleless connector or end cap. Then you're going to loop the tubing near the entry site and secure it with a piece of tape. Next, you're going to open the clamps on the extension tubing and the new administration set. You will perform the same steps that were previously mentioned for resuming the infusion via either an electronic pump or by gravity. Then you're going to apply passive disinfection caps to each site on the administration set. And then you're going to use an alcohol wipe or swab and wipe down the administration set. And then you're going to place, after it's dried, you're going to place passive disinfection caps at each site. To monitor the IV site and infusion, you're going to first verify the IV solution order with the MAR and compare it with the MAR. You're going to monitor the IV infusion at least every hour or per facility policy. You might be checking the infusion more if the person is receiving medications. You're going to perform hand hygiene and identify the patient, provide privacy, and explain the procedure to the patient. If you're using an electronic infusion pump, check the alarms, settings, and indicator lights. You're also going to want to check the infusion rate, and then you're going to observe the level of fluid within the container compared to the time tape. If the solution is infusing by gravity, you want to check the drip chamber and count the number of drops. You also want to check the tubing for any kinks or occlusions, and you want to make sure that all your clamps are open. You'll also observe the dressing for any leaking fluid. As well, you need to observe for any local adverse reactions, such as infiltration, phlebitis, or infection. As well, the nurse needs to look for complications such as fluid overload and bleeding. After the inspection of the IV site and the solution, you're going to remove your gloves and perform hand hygiene. To change the IV dressing, after you've gathered your supplies, identified your patient, and checked for any patient allergies, you're going to put on gloves, place a towel underneath the patient's arm that has the IV in it. If the solution is still infusing, you're going to want to temporarily pause the infusion. Hold the catheter in place with the non-dominant hand. Starting at the device hub, gently pull the dressing perpendicular to the skin toward the insertion site. Carefully remove the dressing and/or a stabilization device. If needed, use an adhesive remover to remove the dressing to prevent dislodging the IV catheter. Inspect the IV for any complications such as infiltration, infection, or phlebitis. If any of these conditions are present, you need to discontinue the IV and relocate it to a new vein. Next, you need to clean the site with an antiseptic solution. Use a gentle back and forth motion to clean the site. You're going to need to let the area dry for at least 30 seconds. Next, apply the skin protectant to the site. Then apply the sterile transparent dressing over the site, and if needed, also place a catheter stabilization device. Make sure to label the dressing with the date, time of change, and initials. Loop and secure the tubing, then resume the IV infusion if needed. Lastly, remove PPE and perform hand hygiene. Explain the importance of safeguarding the IV to the patient and put the bed in the lowest position. After verifying the medical order, performing hand hygiene, identifying the patient, make sure to provide the patient with privacy and explain the procedure to him or her. Then you're going to want to make sure that you ask the patient about any allergies to tape or skin antiseptic solutions. Next, assess the IV site. Then, if you're using an electronic pump, you need to stop the device and then close the roller clamp. As well, if the solution is being infused via gravity, you will also close the roller clamp. Put gloves on and close the clamp on the short extension tubing. Next, you're going to remove the administration set from the needleless connector or end tube on the short extension tubing. Then you're going to use an antimicrobial swab and scrub the needleless connector or end cap. And you're going to allow for time to dry. Then insert the saline flush syringe into the needleless connector or end cap. You pull back on the syringe to look for blood return. If there's positive blood return, you administer the saline over 1 minute. Then, after the saline has been administered, remove the syringe and clamp the tubing. If needed, loop and secure the extension tubing close to the site. Then use an antimicrobial swab and scrub the needleless connector or end cap and allow for time to dry. Then you're going to apply a passive disinfection cap. Lastly, remove equipment, lower the patient's bed, and perform hand hygiene. First step to receiving a blood transfusion, you're first going to make sure that there's a medical order for the blood transfusion. And then you're going to check to see that there's been informed consent completed. Also, you're going to check to see if there are any pre-transfusion medications that are needed, and if so, you're going to make sure that you administer those 30 minutes before the transfusion. Then you're going to gather all your supplies, you're going to identify the patient, set up supplies, provide privacy to the patient, and explain the procedure to him or her. Next, after that, you are going to ask the patient if they've previously received any blood transfusions and if any reactions had previously occurred. You're also going to tell the patient to report any symptoms of chills, rash, itching, or any other unusual symptoms. Then you're going to prime the blood administration set with normal saline IV fluid. Next, you're going to put on gloves and initiate a peripheral IV access if the patient doesn't already have an IV. After that, you're going to connect the blood administration set to the venous access device via the extension tubing. And you're going to infuse the saline per the facility policy. Then you're going to gather your blood products from the blood bank and you're going to scan your barcodes. After you've done that, 2 RNs, another licensed healthcare professional, or if you're in a home-based setting, will compare and validate specific information in the presence of the patient with the medical record, the patient ID band, and also the label of the blood product. The information that you need to make sure that you look at is the medical order for the blood transfusion, the informed consent, the patient's ID number, the patient's name, blood group and type. You also need to look at the expiration date of the blood product, and you're going to do an inspection on the blood product to check for any clotting, clumps, or blood gas bubbles. Then after that, you're going to obtain your baseline vital settings on your patient. And after you've completed that, you need to temporarily pause any infusions that are going. If you're using an electronic infusion pump, you're going to press hold on the device. You're going to close the roller clamp on the administration set on the saline side below the drip chamber, or close to the drip chamber. And you're also going to close the roller clamp on the administration set below the infusion device. If you're infusing via gravity, you're going to close the roller clamp on the administration set. You're also going to close the roller clamp on the blood side of the administration set closest to the drip chamber. Then after that, you are going to set up your blood products. So you're going to take the cap off the access port on the blood product container, and then you're going to remove the cap off the spike of the access spike on the administration set. You're going to use a push and twist method in order to insert the spike into the access port on the blood product. Then you're going to hang the blood product on the IV pole and open the roller clamp on the blood side of the administration set. Squeeze the drip chamber until the inline filter has been saturated, then remove gloves. The administration needs to be set slowly, usually approximately 2 milliliters per minute for the first 15 minutes. The nurse needs to stay with the patient for the first 5 to 10 minutes after starting the transfusion. After that, you're going to open the roller clamp on the administration set below the infusion device, set the flow rate, and start the transfusion. You're going to monitor the flow rate, the function of the infusion device, and watch for any signs of infiltration at the insertion site. You're also going to watch for signs of flushing, difficulty breathing, rash, itching, hives, and any other unusual complications. You're going to reassess your patient's vital signs after the first 15 minutes of the transfusion. Then you're going to increase the infusion rate after the observation period to the calculated rate for the prescribed time that the transfusion needs to be completed in. The transfusion needs to be completed in no more than 4 hours. You're going to want to maintain the prescribed rate per the order or per the patient's response and condition to the transfusion. You're going to need to monitor and assess the patient frequently during the transfusion process. Frequent assessments are needed so that you can early identify transfusion reactions and provide the earliest interventions. If a patient has a suspected reaction to the transfusion, you're going to immediately stop the transfusion. You're going to quickly remove the blood administration set, and you're going to insert a administration set primed with normal saline IV. You're going to start the IV on an open flow rate, usually 40 milliliters per hour, and obtain your patient's vital signs. Then you're going to notify the provider and the blood bank that a transfusion reaction has occurred. After the transfusion has completed infusing, you want to close the roller clamp on the administration set on the blood side, and you want to then open the roller clamp on the normal saline side of the administration set. When the blood is finished transfusing, close the roller clamp on the administration set. Then you want to obtain your patient's vital signs, and next you're going to either cap the access site or resume the patient's previous infusion. After all of that's done, you're going to dispose of the blood products and the transfusion equipment per the facility's policy. You're going to remove your PPE and perform hand hygiene, and you're going to ensure that the patient is comfortable, place their bed in the lowest position, Then you're going to want to continually monitor your patient after they've received their transfusion for a delayed transfusion reaction. And you're going to make sure that you educate your patient about the signs and symptoms of a delayed transfusion reaction. For changing a dressing and in flushing a central venous access device, first you're going to verify the medical order. You're going to perform hand hygiene, identify the patient, gather and set up your supplies and equipment. You're going to provide privacy to the patient, and you're going to explain the procedure to the patient. You're also going to ask the patient about any allergies to tape or skin antiseptics. You're going to place a trash can near the patient's bed for easy disposal of the dressing. Then you're going to adjust the bed to working height, and you're going to assist the patient into a comfortable position with easy access to the CVAD device or to the CVAD site. Any exposed areas on the patient you're going to cover with a bath blanket with the exception of the CVAD site. Then you're going to put on a mask, and you're either going to have the patient turn his or her head away from the access site, or you're going to have the patient put on a mask as well. It just depends on the facility policy. Then you're going to move the overhead table to a spot that's easy to access, and you're going to set up a sterile field. On the sterile field, you're going to open up sterile dressing supplies. If there's an infusion that's currently infusing through the CVAD, you're going to make sure that you put that on hold during the dressing change. You're also going to apply slide clamps to the to each lumen on the CVAD. Then you're going to put on clean gloves, and you're going to assess the CVAD through the old dressing. You're going to palpate the site and note any pain, tenderness, or discomfort. Then you are going to start to remove the dressing, and you're going to start to remove the dressing at the device hub, but make sure that you stabilize the catheter during this. And you're going to gently pull the dressing back perpendicular to the skin toward the insertion site. You're going to do this carefully to make sure that you don't dislodge the catheter or the needle. And then after that, you're going to, after the dressing has been removed, you're going to dispose of it in the trash can. Based on the type of device in use, remove the stabilization device per the manufacturer's directions. A subcutaneous external stabilization device does not need to be removed with each dressing change. Next, you're going to note the presence of any sutures or staples, and then you'll remove your gloves and discard of them. Next, you're going to perform hand hygiene and don sterile gloves. Starting at the insertion site and using a circular motion, you're going to wipe away blood and drainage from the site using an antimicrobial wipe. Then you're going to use a chlorhexidine swab, and you're going to swab the area approximately 2 to 3 inches. You're going to use a gentle back and forth motion to cleanse the area with the chlorhexidine swab for at least 30 seconds and allow for time to dry. Then you apply an antimicrobial dressing and then apply a skin protectant to the same 2 to 3 inches of area that you previously cleansed, but make sure to not get the skin protectant on the antimicrobial portion of the dressing. After the skin protectant has dried completely, you're going to apply a stabilization device if indicated, and then you'll apply the TSM dressing over the center of the insertion site. Measure the length of the catheter that extends out from the insertion site. Next, you're going to work with one lumen at a time and remove the needleless connector or end cap and scrub the end of each lumen with an antimicrobial wipe. Then apply a new needleless connector or end cap, and you're going to repeat this process with each lumen. If required, flush each lumen of the CVAD. The amount of heparin or saline to be instilled depends on the type of CVAD or the facility policy. The first step to flushing the lumen, you're going to use an antimicrobial swab and scrub the needleless connector or the end cap of the lumen. Then you're going to insert the saline flush syringe into the needleless connector. Next, you're going to open the clamp on the lumen. You're going to start by slowly trying to instill the saline into the lumen. You're going to note any sort of resistance or sluggishness. Next, you're going to gently pull back on the syringe and look for blood return. If there's positive blood return, you can go ahead and start to instill the saline solution. You're either going to instill the saline solution over 1 minute slowly, or you're going to use the pulsatile flushing method, which is 10 short boluses of 1 milliliter interrupted by brief pauses. After the saline solution has been instilled, you're going to remove that syringe and you're going to insert a locking solution syringe. And you're going to instill this solution either over 1 minute or per the facility's policy. Once that solution's been instilled, remove the syringe and reclamp the lumen. Then you're going to remove your gloves. After, you're going to attach a passive disinfection cap to each needleless connector or end cap. Then you're going to use an antimicrobial swab and scrub the needleless connector end cap on the extension tubing and allow for adequate time to dry, and then you'll attach a passive disinfection cap. Label the dressing with the date, time of change, and initials. If the IV is to be resumed, make sure that you check the flow rate and make sure that the system is patent. If a stabilization device is not already part of the dressing, make sure to apply that at this point in time. Also, you want to educate the patient on the importance of safeguarding the IV. Lastly, you want to remove all your supplies, perform hand hygiene, ensure that the patient is comfortable, and place the bed in the lowest position. When accessing an implanted port, you're first going to perform your pre-safety checks. You're going to gather and set up your supplies. You're going to explain the procedure to the patient. If you're going to be using local during the procedure, make sure to explain to the patient what the desired effective local is and what the procedure is going to be for injecting the local. After you've completed all this, you want to put your bed at a working height. Then you're going to want to assist the patient into a comfortable position that allows for easy access to the port. Next, you're going to put on a mask, and you're either going to have your patient turn away from the port site, turn his or her head away from the port site, or the patient is also going to put on a mask. It just depends on the facility policy. Then you're going to get the overbed table, and you're going to set up a sterile field. You're going to open your sterile supplies onto the sterile field. The next thing you're going to do is put on clean gloves, and you're going to palpate for the port site. You're going to note the presence of any surgical incisions around this site. Then you're going to remove your gloves and discard of them. Next, you're going to perform hand hygiene, and you're going to don your sterile gloves. Next, you're going to place a needleless connector or end cap on the extension tubing of the non-coring needle. You're then going to use an antimicrobial swab and scrub the needleless connector or end cap. Then you're going to allow time for that to dry, and then you'll insert the normal saline syringe into the needleless connector or end cap, and you'll prime the line with normal saline. Then you'll remove the syringe and place it on the sterile field. The next thing you're going to do is use a chlorhexidine swab, and you're going to cleanse the port site, allowing and cleansing the site at least 2 to 3 inches of area. You're going to use a back and forth motion while cleansing the site, and you're going to cleanse the site for at least 30 seconds. You're going to allow for there to be adequate time to dry, and after the solution is dried, you're going to then use your non-dominant hand to palpate for the port. Once you've found the port, you're going to hold the skin taut and keep the port stabilized. You're going to pick up the non-core needle, and you're going to visualize the center of the port. You're going to insert the needle at a 90-degree angle to the port, or to the skin, and then you're going to insert the needle into the center of the port. After you've done this, you're going to scrub the needleless end cap or needleless connector or end cap with an antimicrobial swab, allow for time to dry, and then you're going to attach your normal saline syringe to it. You're going to instill 3 to 5 milliliters of the normal saline into the extension tubing, and then you are going to gently draw back on your syringe, looking for blood return. You're going to make sure that the blood stays in the extension tubing and does not go into your syringe. If you have a positive blood return, you're going to if you have a positive blood return, you're going to go ahead and instill the remainder of your normal saline solution, and you can either do this by instilling it over 1 minute, or you can use the pulsating flushing method, which is 10 short boluses of 1 milliliter interrupted by brief pauses. Also note that if the port was locked with a locking solution, you're going to need to remove and discard this before you can start instilling your normal saline. As well, when you are instilling your normal saline solution, you're going to want to look for any signs of infiltration, such as leaking of fluid. After you've finished instilling your saline solution, you're going to remove the syringe, and you're going to insert the locking solution syringe onto the needleless connector end cap, and then you're going to instill this solution over 1 minute, or per the facility's policy. After you've finished instilling the locking solution, you're going to then remove the syringe and reclamp the tubing. If you're going to be infusing an IV solution, do not flush the tubing with heparin. If you've been using a gripper needle, you're going to remove the gripper portion, you're going to squeeze the sides together, and you're going to pull them off the needle while with the other hand holding the needle securely in place to the port. Then you're going to apply a skin protectant to the site, but you're going to make sure that you do not have any contact with the needle insertion site. After you've allowed the skin protectant to dry, you're going to apply an antimicrobial dressing, a CVAD site dressing, and a securement device. After that, you're going to apply a passive disinfection cap to either the needleless connector or end cap. Then you're going to remove your equipment, take off your PPE, and perform hand hygiene. You're going to make sure that the patient is comfortable and the bed is in the lowest position. When de-accessing an implanted port, you're first going to perform your pre-safety checks, such as identifying the patient and verifying the medication order. You're also going to gather your supplies and set them up. You're going to explain the procedure to the patient, and you're going to provide the patient with privacy. Then you're going to put the bed into a working height position, and then you're going to assist the patient into a comfortable position that allows for easy access to the port site. Then you're going to put on clean gloves and use an antimicrobial swab to scrub the needleless connector or end cap on the extension tubing. After you've allowed adequate time for that to dry, you're going to attach the normal saline syringe, and then you're going to unclamp the extension tubing. And you're going to be looking for a positive blood return. If the blood return is positive, you're going to instill the normal saline solution either over 1 minute or using the pulsatile flushing method, which is 10 short boluses of 1 milliliter, interrupted by brief pauses. After you've finished instilling this solution, you're going to then remove the syringe and use another antimicrobial swab to scrub down the needleless connector or the end tube. And then after that's dried, you're going to place the locking solution syringe onto the needleless connector or end cap, and you're going to instill this solution either over a minute or per the facility's policy. Then you're going to remove the dressing, and you're going to note any drainage, and then you'll discard that. With your non-dominant hand, with the thumb and forefinger, you're going to palpate for your port, and you're going to stabilize it in place. With your dominant hand, you're going to grasp the needle with your fingers, and you're going to pull the needle out of the port slowly and gently at a 90-degree angle. If the needle guard didn't previously engage the needle guard on the needle. Then you're going to apply pressure to the needle insertion site with gauze. If there is continued oozing, you'll go ahead and apply a dressing to the site, but otherwise a dressing is not indicated. Next, you will discard of your needle and the extension tubing in the sharps container or per the facility's policy. Then you're going to make sure that the patient is comfortable. You're going to keep the bed in the lowest position, and you're going to remove your PPE and perform hand hygiene.